Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, Governor Tom Corbett has replaced a number of leading cabinet officers and other top administrators in his office. We're going to take a look at that with Eric Boehm. And then baby boomers woefully unprepared for long-term health care. We'll listen to Dr. Stuart Shapiro talk about that, and then our popular financial literacy update. All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, Eric Boehm from the PA Independent joins me. He's no baby boomer, right here.
No, certainly not.
All right, well, let's talk a little bit. I mean, much of the news this summer has focused not on the policies that Governor Corbett would like to enact, but on a myriad of staff changes, cabinet officials and other top administration personnel. Highlight that, and where do you think Governor Corbett stands as we move into election season? I think you would agree, after Labor Day, full-throated campaign, re-election Tom Corbett.
Just to go quickly through it, it's really been like a drip, drip, drip almost month after month. Since the late part of 2012, the Corbett administration has seen the departure of 5 cabinet secretaries. One of the acting secretaries who was appointed to replace one of those who departed was just asked to leave this past week. A lot of turnover there. New communications, a new director of communications and spokesperson in their press office. They're now on their 3rd chief of staff. They've replaced their legislative liaison. All of this stuff to people outside the Capitol, probably doesn't really matter, except when you have so much of this and it comes month after month after month the way it has here. It really builds a narrative, and that narrative is, I think, somewhat damaging.
So the point is that it gets the governor off the message, what he's trying to pursue in his policies, and obviously that's not very helpful. Correct?
Sure, and it seems like, I used this analogy when we were talking the other day about it sounds almost like Corbett went in and needed to replace some parts in his car. If you think of an administration as like a piece of machinery like that, there's all these different things that have to be working together. And they replaced a bunch of parts, and then they keep trying to get the car to turn over, and then it won't quite start, so there's another piece that goes, and then they try again. And at this point, it's just become, it really has become the narrative of the summer for him, has been these staff changes. And he needs to get away from that. He needs a break from that so that he can talk about some other things for a change.
Particularly about the policies.
Sure.
Now, the one thing that I think most of the press accounts that I read and most of the comments about it would argue, and I think this is fair to say, we're not being partisan here, that Governor Corbett is better off with these changes than he was now. What's your concern?
Yeah, sure. It's been a rough road, and it's been, some of the departures were voluntary. Others were a little bit less seemly. There were people who were asked to leave for various reasons because of emails they had sent that contained, things that you shouldn't put in an official staff email. But yeah, I think on the whole, the administration is probably better off now. I think certainly as a reporter dealing with their press office, I think they seem to be more active and more engaged now. The general reception to the new legislative liaison that was brought on has been very positive so far.
Chief of staff, more positive.
Chief of staff, again, positive change. Leslie Gromas-Baker,
a whole bunch of names.
Right, who has campaign experience, and that is obviously a good thing as they move into next year.
The other thing I want to ask you about is there was a little dust-up about Attorney General Kathleen Kane promotes her sister, Ellen Granahan, to head the child predator unit in the Attorney General's office, potentially in violation of Pennsylvania's ethics law. Give us a quick thumbnail about what you think the importance of that is.
Yeah, apparently Kathleen Kane wanted to get in on the staff controversy issues this summer, didn't want to leave it all to Corbett. She appointed her sister, Ellen Granahan, to run this one. It's one of the more high-profile departments within the Attorney General's office. Yeah, very important one, started by Corbett, I think, actually, when he was there. So she gets promoted, and she already worked within the department. It's not like they went out and got her. She was a prosecutor within the AG's office, but the promotion came with a $14,000 raise, which certainly raises some eyebrows. Now, Kane says that her sister-in-law, Granahan, was the best person for the job, and maybe that's true. Maybe she is the best person of all the prosecutors in the whole state.
Qualifications isn't the issue, right?
Maybe she is. She certainly seems qualified. But when you're in politics, it's also about how something looks, and of course, whether something complies with the state ethics law. Both of those things are very important.
Which seems to...
And she may have violated both of those.
And we'll have to see if there's a complaint. Great update, Eric. Thanks for coming on the program. All right, Dr. Shapiro is here. We're going to... What's this about baby boomers unprepared for long-term health care costs? And all of the conversations that need to be held about how you insulate yourself, protect yourself from big medical problems. Dr. Stuart Shapiro will be with us in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation, educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
And welcome back to the program. Well, joining me is Dr. Stuart Shapiro. He's president and CEO of the Pennsylvania Healthcare Association. The host will be able to get these names out. Dr. Shapiro is one of the healthcare experts we call in from time to time. All right, one of the things we're going to talk about, Dr. Shapiro, first of all, welcome to the program.
Glad to be back.
Let's get on with the specifics of it. Look, baby boomers, you have some real concerns, and you've articulated those very well about how young folks, or baby boomers to be more correct, as they move towards senior citizen years, are just unprepared for what's coming. What are the top lines in that? What are the top 3 or 4 points?
Let me put it all in perspective. The good news is life expectancy in America has gone up dramatically.
And we like that.
And we like that. The bad news is it's going to have lots of people. And the systems are not prepared for health care, financially or socially. And let me put some meat on those bones. Polls have been done recently of baby boomers. Most of them think that they're never going to need long-term care when they get older. The facts are that 70% are at some point going to need sustainable, primarily in a facility, a nursing home, an assisted living facility, 70% some form of care. People have refused to talk about these issues. It's very uncomfortable. And if you look at who's going to pay for all of this care, and you do another poll, which has been done, and you do polls all the time, people believe Social Security, Medicare, Medicaid, or health insurance is going to pay for that care. Social Security doesn't. Medicare only pays for short-term rehab.
Days? Is it 90 days? Or
100 days after you come out of a hospital, and
it.
then it only pays for part of it.
Right.
Medicaid only covers the poor, and it does not have money to sustain it for these number of people, and health insurance won't. So people need to begin to have discussions.
Yeah, you know, is this, I think you've raised a couple of good points there. One of them, that, is it just that we're reluctant to talk about, you know, that people don't want to sit down and say, you know, we got to think ahead and look at what happens if one of us has to go into a facility, you know, as you pointed out. Are we just reluctant to admit that?
The simple answer is people don't want to talk about it.
Yeah.
And they're very reluctant. Now, I can tell you that 90% of us are going to get frail, old, not be able to run around, and not live alone. And I could guarantee you, and I'm sure some of your viewers are going to be nodding their head, most people delay this discussion until a crisis happens. And then they scramble, where people need to, in their 50s and 60s, talk with their families, talk with their loved ones, talk with their spouses, talk with their friends about how they're going to address these issues before the crisis. And there's lots of solutions out there, and there's lots of people to talk to, and there's lots of ways to find care and plan for that care and visit facilities well in advance. So people are there, and I think you're going to show a website that lists some of these. But the way that you can find this care.
Website is up on the screen. Go ahead.
Great.
Yeah.
But
Now
people just don't want to have that discussion.
But this is, as Meryl Streep might say, it's complicated. I mean, you've got, as you point out, you got long-term insurance, you got annuities, you got reverse mortgages, you got. I mean, there's a myriad of ways to potentially fund this, and when we tend to think of paying off mortgages, paying off our cars, paying off our debt, a lot of folks don't think, well, what happens if I need this long-term care? I think that's your big point. It's not one of those things that go into our thinking about our finances and our future.
Right. People are not thinking in their 40s, 50s, or even early 60s, should I buy long-term care insurance?
Right.
They're not saying, does my life insurance policy, which they buy, is there a conversion to pay for long-term care,
right,
so I don't have to end up on Medicaid and be a burden to the state? What about reverse mortgages? Now, there are scam artists out there.
Yeah.
And one needs
we see
to
those
be
advertised all the time.
very aware of it. Talk to your financial advisors, but plan ahead.
All right, we're going to run to a break. We're going to come back. I want to talk with Dr. Shapiro about Medicaid expansion. I have one of those long-term policies that cover me if I need to go into a facility. So you see, I'm thinking ahead there, doctor.
But you also want to make sure that
I got to go. They're telling me I got to go. We'll come back. We'll finish this. Let Dr. Shapiro finish that thought in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back with Dr. Stuart Shapiro, one of the healthcare experts we call in from time to time. All right, finish that thought. If you can remember it, I can't remember it. What were you saying?
I can remember it. I'm still
Wonderful.
a baby boomer.
There you go. You're a baby boomer.
The question really is, you said you had long-term care insurance,
Right.
and other people are looking at long-term care insurance. Make sure when you do that it covers not only care in a nursing home, but also care at home. And not all the policies do.
I'll have to go check that tonight.
And you really, everybody should have those options
Wonderful point.
in their policies when they buy it.
Wonderful point. Wonderful point. You're all listening out there to that. All right. We've had folks on who support the Medicaid expansion. You're not, Governor Corbett still has to make the decision. The legislature would have to go along with, it would require some state funding. That decision has been in abeyance. You're not in favor of it. Why?
I'm not in favor of it.
Okay.
What I am in favor is exactly what Governor Corbett is doing. He's looking at the ramifications of expansion. The liberal knee-jerk reaction would be, oh, let's expand. Let's not look at what it will cost us a year from now and 5 years from now. Mm-hmm. That's not Tom Corbett. Tom Corbett is looking at, as he should, and the legislature is looking at it, as it should, is is this going to work for Pennsylvania? Will there have to be a tax increase? And well, I don't want a tax increase. So the governor is thinking through these issues carefully, and he takes some criticism for moving slowly, but on this one, he is absolutely right. Just like he was absolutely right in the budget when he did it this year, and the legislature did it this year, state budget, to put in dollars to pay for the frail elderly in nursing homes. Right. So there was a place to do it. He looked at this as a priority. The legislature and the governor are also looking at long-term care priorities. They have a long-term care commission that was created, and the governor did something I think from a preventive standpoint is really good. Mm-hmm. He has created, by executive order, an Alzheimer Planning Commission. Alzheimer's disease takes us back to the first part of this discussion on the first half of the show, is a disease that affects the elderly. Right now, there's probably 400,000 Pennsylvanians who have Alzheimer's disease or one of the other
dementia-related
diseases.
Yeah.
These are diseases just like heart disease, just like lung disease, that need to be reduced. And they can be reduced by simple preventive measures, like exercise, which also reduces heart disease,
Right.
like brain activity, like keeping your cholesterol down, like losing weight. But what they are doing is they're addressing, both the legislature and the governor, they're saying priorities are the frail elderly, and these are the way it should be. And they're saying we don't want to expand Medicaid and take dollars away from
Those
the
programs.
elderly or the disabled,
Okay.
because any Medicaid expansion, if it's done the way it was proposed in Obamacare, we'll take dollars away from the elderly and the disabled. And that's something that none of us want.
All right, thanks for coming in. Thanks for the update, as always. When we come back, our popular financial literacy update, students, student debt, all those problems, student incomes after they graduate, you're going to find is very fascinating, and it comes up next.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to our popular financial literacy update. Guess who joins me? Sue DeStephano. She's the VP of Lending, First Capital Federal Credit Union, and Russell Evidence. We have another vice president on business development at the Pennsylvania Credit Union Association. All right, folks, look, we all understand the value of education. We often talk about it in terms of communities, of lifelong learning, of citizenship, in so many ways. But there's also, Russell, I'll start with you. There's also a value financially.
Definitely,
right?
yes. Having a college education is still the way to go. Even though costs have risen, having a college education allows you to increase your earning potential and also increase your likelihood of finding employment. So it's still the way to go.
And it's a pretty significant difference in terms of high school. I think $30,000 on average. College, $57,000. Go to graduate school, get an advanced degree. Of course, in this economy, if you can find a job. Plus, there's a relationship between education on the one hand and unemployment. Even though a lot of young college graduates, are having trouble in this economy, but overall, what's that relationship like? Unemployment?
Unemployment is much higher if you only have some college or a high school diploma. So unemployment is much higher for that group of people. So parents and students are trying to find ways to make it happen, to have their child educated. They're finding ways. They need to know all of the loan options that are out there. Starting with the FAFSA application, that's of course your first stop. Usually scholarships and grants after that. That will go nationally, go locally. Look at your credit unions. Our local credit union has scholarships available, and then also after that, of course, there's private student loans, which we offer.
One of the things, Russell, that always struck me is, we have these programs. The treasurer in our state runs a program. Most states have them. This is really something people need to think about when their kids are almost infants. Am I correct about that?
You're correct. My son's in kindergarten.
Are you working on it?
I'm already worried about what that cost is going to be, and I have a 529 plan as
Excellent.
well. But it's great to know that I have credit unions like Sue's credit union that's there for me when he does go to college, so I have somebody to lean on.
Yes, financial literacy is huge. You need to start early, definitely.
Yeah, I think there isn't any doubt that there's now a real concern on college campuses. I spend my life on one about costs and how to reduce them and what we can do, but there's also expansion of programs that, sometimes we're told by the state or the federal government we need to do them. I won't go into all of that. But Sue, there's a gap also between federal aid on the one hand and what it is that you have available in your own resources, plus the differential in cost going public versus private, correct?
Right.
Schools, colleges.
As Russell
universities.
mentioned, you can save as soon as your child is born and think you're prepared, or use equity in your home. But with home values depreciating, the equity isn't always there in your home. So that gap, there's private student loan options that are out there. Many credit unions across the state and nation offer these private student loan programs. And it will fill that gap, because at the very last minute you realize, hey, we're running short, we need some more money.
Yeah, and it used to be that you could turn to a bunch of private lenders, but I guess this credit crunch, I'm not an expert on this, I'm probably way out of my dimension right now, but apparently because the private marketplace isn't doing it, it makes lending all the more difficult. Is that correct? Or finding the appropriate place to go?
Yes, the government made some changes which kind of limited who could play in this space, but credit unions have stepped up as balance sheet lenders to be able to have or be a resource and have options for consumers. And Sue's credit union does a great job of letting their members know of their options and walking them through the process.
Absolutely.
Yeah. So there are a whole bunch of, just quickly run through the types of student loans in the marketplace that people should be aware of.
Sure, absolutely. You want to start with your FAFSA application, the free application for financial aid.
Is that acronym?
Always
I got it.
FAFSA.
I got it.
Always
I
start
got it.
there.
Let me
That
get
is
that
always
acronym.
really going to be your first stop. After that, after you find out what you qualify for, look at your scholarships and grants and see what your options are there. First Capital has a scholarship, so they're not going to come knocking on your door. You have to go knocking on their doors, but you can get a lot of scholarships.
I noticed, Russell, that when dealing with a lot of students in more years than I'm going to talk about being in on a college campus, that there are lots of scholarships that people may not even be aware of. That figuring out how to pursue those, makes a lot of sense. I mean, every dollar, in a sense, then does help, right?
Yeah, well, thank goodness for the internet. That's a great place to go
that's
to
true.
find out what type of scholarships there
Yeah.
are. But Sue said a lot of credit unions and financial institutions are overlooked of having options for scholarships, and the credit unions are out there with money for students to take advantage of to go to school. So go to them first, definitely.
Absolutely.
Yeah, I mean, how difficult, we have about a minute left, how difficult is it to get a loan, to get this student aid, given that a lot of families, just simply may not have the resources given for for various reasons?
I think the biggest advice is never say never. Definitely apply.
Yeah.
Don't think you make too much money or don't think you have credit issues. Definitely apply and see where you are.
Yeah.
That's the best advice. Because if you want an education, you have to start there. Start with the FAFSA and definitely apply.
Yeah. Yeah, I'll take the last word just to make a comment and see if you agree. I mean, I think what people also have to do is look what's affordable and find, there are great colleges and universities, both in the public and private sector, and figuring out how to get that, get the right amount of money that you need, plus what it is that you have to pay. I mean, what's the tuition? What are all these ancillary costs? And I think being realistic is important. Would you agree?
Absolutely.
Well, how about that? I got you both to agree. All right, we'll see you next week, as always, for another edition of Pennsylvania Newsmakers, and stay well.